Welcome to Your Family's Health, the program that focuses on healthcare issues with unique and different modalities for taking charge of your health today. Experts talk weekly with our continuing roster of guests from around the country and right here in Nassau County to keep you up to date on the latest health issues and trends. Take care of your mind, body, and soul. Spend the next half hour with the voice of Nassau Community College, 90.3 WHPC, and get on the journey to better health.
Hello and welcome to Your Family's Health. My name is Dr. Jeanine Cook-Garard from the nursing department here at Nassau Community College. And today we're going to talk about a health issue rarely addressed. That's the whole point of the show, actually, to introduce you to new health terms and make you aware so that you can hopefully help family, friends, or even yourself if you ever come across symptoms like the ones we will describe today. Today, our topic, a health issue, is known as cachexia, a condition that causes the body muscles to waste away. It comes with extreme weight loss and can include loss of body fat. It usually is one of the symptoms that appears when you have a chronic condition. My guest today is Dr. Ken Gruber, the founder, former CEO, and current Chief Scientific Officer of Endevica Bio, a biotech company developing drugs for conditions which may lack any true therapy. Dr. Gruber, welcome to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.
Thank you.
So first of all, I hope you're doing okay in light of the pandemic. Has it affected you personally in any way?
The company was fine. We went more virtual after the pandemic, and we've been just fine, especially now that everybody is vaccinated. It was actually useful to force us to begin using more contractors, both in the United States as well as in foreign countries, to do the work for the FDA.
Awesome. Please discuss your background, include your time as a researcher for the NIH and how your role in Endevica Bio is now and what are you doing?
I'm a New Yorker and educated in the New York City school system. Went to New York University for both my undergraduate and postgraduate work towards my doctorate. And then I did a fellowship in New Jersey, not too far from New York, in Nutley, at the Institute of Molecular Biology funded by Hoffman La Roche. And then I started a medical school career as a faculty member, almost 20 years as a faculty member, as well as an administrator at various institutions. But during that time period, I was also a branch chief at the National Institutes of Health. And that's a great training place to learn how to manage large research programs, to be able to handle new areas of research that are given to you. So it really is the perfect training if you're going to start your own biotech company, because you never can predict the areas of research and expertise you're going to need in order to bring a drug through commercialization. You may think you know it, as I thought I did, but it changes on a monthly, weekly, sometimes daily basis.
So tell us your role in Endevica Bio.
Right now, I am the person in charge of shepherding our current lead anti-cachexia drug through the FDA process, though everybody on the company is focused on that as well, but also on finding new areas of research for us to do, new drug potentially for us to commercialize for other chronic diseases.
So for people who are not familiar with the term cachexia, how would you describe it? Define it for me.
Well, I was thinking about how I would try and define cachexia for someone who's not really scientifically trained. And the simplest way is to use the analogy of an automobile engine. Automobile engines convert fuel into work, and they do that by compressing it and having a good compression in the cylinders and causing the pistons to do work. But in certain engines, you get problems occurring like a lack of the ability to maintain compression, and you're leaking energy. And that's one of the main symptoms of cachexia. You can eat the food and you can bring it into your cell, but the conversion to a common form of energy that all the cells in the body can use is faulty, and you're literally leaking energy the way a bad car engine leaks energy and can't do any work properly. And one of the symptoms of that is you're not going very fast forward in a car that has a compression problem. So you give it more gasoline and you cause your RPMs to go up, and you can get the RPMs into the red line. Well, in cachectic individuals, where you're leaking energy, the central nervous system tries to overcome that by increasing metabolic rate. And you get a hypermetabolic condition. And that condition can get, just like RPMs, into the red line, where the cells literally can't live with that kind of high metabolic rate. And the individual organs of your body will go into what's called programmed cell suicide. And that's why in many diseases, for example, cancer, you have multi-organ failure, even in organs that aren't directly affected by the cancer. They just can't take the high metabolic rate, and they go into this programmed cell suicide where the cells start dying. And that's very, very difficult to go in there with any drug and try and reverse programmed cell suicide.
So would cachexia be considered a disease or a symptom?
It's a symptom, but a condition unto itself. In other words, you can cure in animals that we've worked with, and that includes our animal and small animals in the lab, as well as a national canine cachexia trial where we took veterinary hospitals across the United States. We took in animals that were ill, as well as in our experimental animal models. We take animals that have a disease, cancer, for example, renal failure, and they also have cachexia. We can literally cure the cachexia in those animals. We've done that in animals who have come in from their owners. These are client-owned animals with cachexia, huge weight loss for various reasons, and we've gotten the animals cured of the cachexia. And the cachexia is really more than just weight loss. If you look at a lot of the symptoms of cancer, where you have fatigue, you have problems in digestion, because cachexia is a multi-organ disease, we can cure or reverse many of those symptoms. And in the dogs we've worked with, many of them, all of them for really most purposes, came in because the owners had had euthanasia of the dog recommended to them because they had lost so much weight and were continuing to lose weight. We reversed that, and some of those dogs have lasted, and even with the disease, lasted for several years and with a good quality of life. No one knows the natural history of cancer in the absence of cachexia.
Interesting. So what is the difference between malnutrition and cachexia?
Well, malnutrition is where you can reverse the problem by giving the person caloric supplements. You've got to be very careful, because if you're really malnourished, your digestive tract is in a bad state of regression, and you have to slowly give the person. In cachexia, it doesn't really matter how much food you give them. Just like, to go back to the car engine problem, the solution to a bad car engine is not putting more gasoline in the tank.
When it comes down to cachexia, how many people are affected by cachexia and how many people die from it?
Well, I can give you, there are 5 major diseases that are usually described as having cachexia as an important comorbidity, as we would call it, condition. And they are renal disease, cancer, chronic obstructive pulmonary disease, rheumatoid arthritis, and heart failure. And if you add all those diseases, the cachexia incidence in all those diseases in the United States, the affected population at a low is about 38 million as low as 21 million and a high of 38 million. But those are just 5 diseases. Cachexia is part of all chronic infectious diseases. And it's now appreciated that infectious diseases like COVID have a large component that is cachexia. And in fact, the symptoms of long COVID would suggest that about 50% of the people with long COVID, in fact, have cachexia.
So would you say with cachexia that it is a loss of appetite, or is it no matter how much I eat, my body has a way of burning all of the kilocalories that I may consume? Which is it, or is it both? It's
that your body is inefficient in its conversion of food to energy. And I'll give you an example. Children with renal failure who are on the list to get a renal transplant, kidney transplant, one of the problems is a lot of the children are in the growth phase of their life, and they have stunted growth because they can't mobilize the food into energy needed for growth. And giving them more calories artificially, all that happens is they don't grow, they just get fat. The body can't use the calories they're taking in, and so it doesn't want to let the calories go, but since it can't use it profitably to repair organs or to grow, it just stores it as fat. And then you have a child with renal failure who also has what's called metabolic syndrome because of obesity. So you really can't overcome cachexia just by giving the person more calories. If anything, they're going to store the calories as fat.
You're listening to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. My name is Dr. Jeanine Cook-Garard, and today we're learning about an illness, disease, condition called cachexia, a condition that causes the body muscle to waste away, extreme weight loss, and can include loss of body fat. It's usually one of the symptoms that appear when you have a chronic condition. My guest today is Dr. Ken Gruber, the founder, former CEO, and current Chief Scientific Officer of Endevica Bio, a biotech company developing drugs for the condition which lack any true therapy. So tell me about the treatments that are currently being used and are available for cachexia. And does it improve the condition, and where can I find them?
There's no drug approved for cachexia. The drugs that are used in cachexia were approved for AIDS wasting disease back in the mid-1990s. The problem is they were approved because there was no really good treatment for AIDS wasting disease, and they were quickly dropped from AIDS as the AIDS formulary because just about the same time those drugs were approved, antivirals for AIDS became approved, and that reversed the AIDS condition so dramatically that there was no need to use them for HIV or AIDS disease. They are used in wasting diseases like cachexia, but they're really just appetite stimulants. And as I said, cachexia is not just an appetite problem. It is a problem in the central nervous system that is in all diseases where you have an activation of the immune system. Products of the immune system have a side effect of activating areas in the central nervous system that increase metabolic rate. And also, they can increase inflammatory aspects of the central nervous system. And that also increases metabolic rate. It causes chronic fatigue. And in some of the dogs we've worked with in our veterinary hospital trial, the first reversal of the disease is not body weight gain. It's in fact a recovery of normal motion of the dog. The dog begins to have a lot more energy. That's a report that all the veterinary hospitals that we've worked with have told us about how amazing it is to have an animal that was moribund, essentially couldn't really move, couldn't walk up a flight of stairs, who now wants to go out and play.
So what is Melacortin? I'm hearing that is something that you're currently researching.
Yes.
To try to help this disease?
Sure. Melanocortins are a class of drugs that have been found in all vertebrates, cold-blooded and warm-blooded animals. And initially, their main function was color change in the animal. And everyone thought that was mainly to escape predators. But in point of fact, it had another important aspect to it, which was if you darken your skin, like a frog skin, they absorb heat better from the environment. And they're cold-blooded animals. So at times where there's a low temperature out and they want to move around, they've got to absorb more calories from sunlight. And they can darken their skin and absorb calories. When warm-blooded animals, or even before warm-blooded, in animals that were more in a stable environment, melanocortins, which are peptides, and maybe I should explain a peptide. A peptide is a string of a kind of compound called amino acids, like a string of pearls. And there are about 23 amino acids, and the sequence of the amino acids in that string carry an information like a word. Think of the amino acids as letters and the string of amino acids as a word telling the body what to do with that peptide. So in humans, warm-blooded animals, melanocortins are really involved in many aspects of growth and utilization of calories and appetite. Another problem with cachexia is a loss of appetite with the disease. So that the person doesn't even feel hungry, even though he's losing a lot of caloric. And all that is tied up with the melanocortin system. Our drug for cachexia is a synthetic derivative of the melanocortin system that blocks the high metabolic rate and restores appetite to animals with cachexia, even in face of the fact they still have the disease.
What have been some of the challenges with making Melacortin safe and effective for individuals?
Well, the first challenge that other investigators ran into was the fact that the drugs they were making had cardiovascular side effects due to the melanocortin drug. Fortunately for us, before melanocortins were even considered a potentially important drug for regulation of metabolic rate or appetite, we had worked with melanocortins purely as an interesting way of working with peptides to learn more about how to regulate them. And one of the aspects of melanocortins in a very basic science way was that the ones we were working with would have cardiovascular side effects. But it wasn't a cardiovascular side effect due to the melanocortin message the peptides were carrying, but to another sequence within the melanocortin. Peptide sequences are just like words, and there can be words within words. And if you ever did a search on a computer trying to find a particular word, your computer program will ask you, do you want to find this sequence as a standalone or as part of other sequences? And where it's part of other sequences, you have a word within a word. And the cardiovascular effects were a cardiovascular sequence that didn't necessarily have to be activated. You could arrange that melanocortin sequence. You could derivatize it. The body does that by adding more peptide, more amino acids surrounding the melanocortin sequence. But when you make a drug of peptide sequence, peptide drug, you want to have as small a sequence as possible to make it potentially be orally available or to do other things in the body. we knew how to get rid of the cardiovascular side effects. So immediately when we decided to make melanocortin drugs, all the problems that drug companies around the world were having with cardiovascular side effects, we solved that in a matter of months. The next problem we ran into was we needed to get the peptide into the brain, and the brain has a barrier surrounding it called the blood-brain barrier. And it's very, very difficult to get things across the blood-brain barrier. So we had to spend several years working at learning how to get peptides to be transported across the blood-brain barrier. And we finally did that, and were able to begin to cure animals with cachexia. And then once we had safety and efficacy established in small animals, we were able to then go and begin working with veterinary hospitals across the United States to recruit dogs, client-owned dogs that were dying of various diseases, but had the main problem was that they were losing so much weight due to cachexia. And we were able to reverse the cachexia in most of those animals.
You're listening to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. My name is Dr. Jeanine Cook-Garard, and today we're learning about a disease or condition called cachexia, a condition that causes the body muscles to waste away, extreme weight loss, and can include the loss of body fat. It's usually one of the symptoms that appear when you have chronic conditions. My guest today is Dr. Ken Gruber, the founder, former CEO, and current Chief Scientific Officer of Endevica Bio, a biotech company developing drugs for conditions. So what is the next step for Melacortin? Are you anticipating starting human studies with this drug?
Yes, we've already had our first in-person meeting with FDA, and they have approved initially the clinical trials we proposed to them. We have to do some more formulation work for the drug as in the form we're going to give it. We expect to start clinical trials in early to mid-spring of 2022. The FDA has asked us, as soon as we finish the phase 1 trial you do for a drug approval is a safety trial in normal humans. And we're going to be meeting with the FDA after that trial to discuss the final efficacy points that we're going to be using in the patients that have been cured of cancer but still have cachexia in our phase 2 clinical trial.
So, of course, it's early, but do you anticipate this Melacortin being used for other diseases outside of the ones that you discussed?
It could be. We think it could be used. In the case of cancer, we developed a form of melanocortin that was given by injection. A lot of cancer patients are taking other drugs which have deleterious effects on the gastrointestinal tract, and they don't absorb drugs very easily. And that's a problem, in fact, with very severe forms of cachexia. The GI tract has a very high cell division rate, and high division cell rate organs are the ones most affected by cachexia. But we're trying to develop an orally available form of the disease for more chronic. But you could, in fact, give our drug by injection, and the FDA recognized that. Typically, when they approve a drug for cancer, you can do your normal, you can do your safety studies in cancer patients. They told us, we initially proposed that, and they said, no, we want you to do your normal, we want you to use normal patients for your safety studies. And that, to a certain extent, didn't surprise us, because in a lot of the experimental models we used, we not only used cancer, we also used renal failure and infectious diseases. So we knew that we could use our drug, and the FDA, I think, recognized that once we were approved for cancer, that physicians could approve it off-label for other diseases, and they wanted to ensure that in normal patients, not just in cancer patients, our drug would be safe.
So if someone is suffering from cachexia or another potentially fatal illness, how can friends and family provide emotional support? And if you can, I know you may not be able to in your company. However, who are other resources that we can use to provide this kind of emotional support?
Good medical, tertiary care medical centers have the expertise to deal with this much better. For example, at MD Anderson, where we may be doing one of our clinical trials, their patients who have cachexia, or cancer for that matter, are given a staff of including nutritionists to manage some of the symptoms of their disease as best they can. Even if you have problems in eating, you still can maintain potentially good vitamin intake. You can maintain other nutrients, not just ones that are metabolized, but say minerals, things that are important to maintain other functions of the body. So you're not just worrying about the food. There are other nutritional supplements you can take that could ameliorate some of the symptoms that cachexia could be giving you.
So if we wanted to find out or find you, your company, where can we get more information? Do you have a website?
Yes, we do. You can use our name, Endevica Bio, or you can use the name of our company, our corporate name, which is the name I gave it, TCI Peptide Therapeutics, and they'll all come to the same website. We changed the name of the company when we began getting ready to go public to give it a more interesting name. But it all leads to the same website. And in fact, if you just look at my name and TCI, you'll wind up on the TCI website.
Thank you so much for the information, and thank you for being here, Dr. Ken Gruber, the founder, former CEO, and current Chief Scientific Officer of Endevica Bio, a biotech company developing drugs for conditions which lack any true therapy. We hope you stay safe and continue to stay healthy, and thank you for being our guest today.
Thank you very much for inviting me.
This is Dr. Jeanine Cook-Garard from the nursing department here at Nassau Community College, and we want to thank you for listening to this week's edition of Your Family's Health.
We'd like to get your feedback on your family's health. Send your comments by emailing them to whpc@ncc.edu. Podcasts of today's show are available on iTunes, Android Podcasts, and Spreaker. This program was produced at the studios of Nassau Community College in cooperation with the nursing department. Join us next week for another edition of Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.